Hello, my name is Tamas Szakmany, the Associate Editor for Social Media at Critical Care Explorations. Here are my top reads for the journal this month. General improvements in sepsis recognition and initial care thought to have a positive influence on patient outcomes. However, navigating the initial process is fraught with difficulty in the busy healthcare systems. Dr. Gajewski and colleagues investigated whether an end-to-end, partially automated telesepsis solution could help to increase the compliance with the SEP1 bundle. In an already high-performing system, they found that dedicated nurse coordinators working via teleconsultation and helped by automated detection and monitoring algorithms could increase the SEP1 compliance compared to historical cohorts and to the surveillance-only period. It is remained to be seen if better processes would indeed lead to better outcomes. However, this work indicates there is a possibility to leverage telehealth technology for this disease. When a critical event occurs on the ICU, resources are drawn to deal with this from the entire unit. There is a possibility that this has an effect on patients in the neighboring beds to the critical incident. Dr. Arshad and colleagues tested this hypothesis in a retrospective study in a quaternary PICU. They found that the most common critical event was initiation of mechanical ventilation. Interestingly, a critical event reduced the risk of another one occurring in the neighboring patients by almost 20%. This protective effect slowly faded out after about 6 to 12 hours. And in the discussion, the authors elaborated on the different reasons why this might be the case. The decreased risk might represent increased vigilance and resilience by the care team after a critical event. Reducing VTE complications in hospitalized adults has been a long journey, and since the pandemic, this has further interest to many clinicians. In a systematic review and meta-analysis, Duval and her colleagues examined if the additional use of pneumatic compression devices to pharmacological prophylaxis can significantly reduce thromboembolic complications. They found that the evidence was poor, and although VTE and DVT risk appeared to be reduced significantly, PE risk was not affected by the use of pneumatic compression devices. The authors highlighted that the apparent reduction in VTE and DVT events were more pronounced in industry-sponsored trials, and that there was a possibility of publication bias towards studies showing effectiveness of these IPC devices. Please take time to read these articles and more by visiting ccejournal.org. Also, follow us on social media at Crit Care Expo. Stay safe, everyone. Bye.